Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, management of coronary syndrome. Okay, first in acute coronary syndrome, antiplatelets are given to the patient. In antiplatelets, actually the main guidelines is all patients of acute coronary syndrome they should receive double platelet therapy, double antiplatelet therapy, not a single platelet. You should give two antiplatelet drugs are given immediately after arrival of the patient, immediately or on arriving of the patient to the hospital emergency. Then we should give a double antiplatelets are given. So that means if you do a early antiplatelet therapy, if it is done with mi, so this is found that it will reduce the risk of mi in the patient. Sorry, if you give early aspirin therapy, sorry, antiplatelet therapy with aspirin, it is found that it will reduce the risk of mi, and it will also reduce the overall mortality in patients with acute coronary syndrome. Then if you see here, aspirin should be given, and along with this aspirin we should add a second agent, that is any of the three. Like we should give aspirin along with aspirin any of the three. That is, we can either give a drug clopidogrel, or we can give prasugrel, or you can give ticagrelor. Okay, we can give aspirin. Along with aspirin we should give any of the three, that is clopidogrel, prasugrel and ticagrelor is given. Actually all these drugs are, what are they belong to they belong to p2y12 receptor inhibitors. So in the management of acute coronary syndrome we should give these drugs. Okay, this is about antiplatelets. Then we can also give it for coronary vasodilatation. We can give glycerol trinitrate can be given to the patient sublingually. Okay, then we can give analgesia can be given. For analgesia we mainly use morphine. 2 to 3 milligrams IV is given, or we can give 10 to 15 milligrams. IM can also be given. Then we can give beta blockers are given to the patient with the help of metoprolol. Then you can give angiotensin converting enzyme inhibitors are also given. In angiotensin converting enzyme inhibitors, right, this is important. Angiotensin converting enzyme inhibitors, if you see, they will actually control the blood pressure, because by inhibiting the angiotensin converting enzyme and thus reducing the aldosterone level, they definitely control the blood pressure. They also control the left ventricular function. Okay, and they also help in remodeling of the infarcted tissue. So because of its action to remodel the infarct tissue, and also because it controls the left ventricular failure, so it is actually the best mortality benefit drug which you should definitely give in a case with uh, myocardial infarction or acute coronary syndrome. Then we can also give low molecular weight heparin can also be given to the patient. In the low molecular weight heparin is given, which is mainly the drugs like enoxaparins can be given to the patient. Then we can also give GP2B 3A, GP2B 3A antagonists are given to the patient, and these are tirofiban. GP2B 3A antagonists like tirofiban is given to the patient. These tirofiban actually they are used in, where do you use this GP2B 3A? They are used in high risk patients. Okay, then we also have, we can see we can use these GP2B3A antagonists. These are mainly used in patients with persistent or recurrent ischemia. Okay, they can be used in non-ST segment elevated myocardial infarction, or they can be used in patients with diabetes, or in patients who are undergoing or going to undergo angioplasty And in stenting also we can use this GP2B3A inhibitors can be used. Okay, next. Next, if you see in the coronary artery disease, you can also use statins. What do statins do? Statins will, for the statins should be kept, they should be given to decrease the LDL. So they will decrease the LDL, and the LDL level should be less than 70 milligram percentage. LDL is one of the important risk factor for increased LDL is one of the risk factor for acute coronary disease. So thus statins also have a mortality benefit. Then thrombolysis can also be done. Okay, thrombolysis if done, actually thrombolysis is done if primary angiography is not available. See, if primary angioplasty is available, then we do a primary angioplasty. If it is not available, then thrombolysis is done. So if you see the actual graph for MI, so if there is MI in a patient, if you suspect an MI in a patient or acute coronary in angiogram, that is ST segment elevated MI, in such cases, first, there are two things. Normal treatment has already dealt all these above drugs should be given. Along with that, you should give, see, if the patient is, if percutaneous coronary intervention is available, then in less than 90 minutes, then you should give this percutaneous coronary intervention. But if percutaneous coronary intervention is not available due to any reason, then in such cases you should give thrombolysis should be given to the patient. Thrombolytics is given to the patient, and this should be given within 12 hours of chest pain. Within chest pain, within 12 hours of starting of chest pain, we should give thrombolytics. Okay, now what are the contraindications of the thrombolytics? Contraindications to thrombolytics are not used if there is any history of major bleeding into the, if there is any history of major bleeding into the bowel, or if there is any major bleeding into the brain, or if there is any major surgery which is seen in the last 2 weeks, or if there is any severe history of hypertension of more than 180 by 110 millimeters of Hg, okay, or if there is any non-hemorrhagic stroke is present in the last 3 months. So in all these conditions, thrombolytics is contraindicated.
Thank you and thank you for watching.